Before we get started with the presentations, we are going to focus a lot on psychotherapy today, and it occurred to me that we haven't actually introduced the construct of borderline personality disorder. So I wanted to review the diagnostic criteria and the general feeling of what the symptoms are for the disorder before we get started. This will be really brief. This is an extra handout in your book. It's one of the sheets that came in it. BPD in DSM-5 is very similar to BPD in DSM-4. It's defined as a pervasive pattern of relationship, self-image, and affective instability, and marked impulsivity. And in order to meet criteria in the diagnostic manual for this disorder, you have to have 5 of the following criteria: frantic efforts to avoid abandonment, unstable or intense interpersonal relationships, identity disturbance, dangerous impulsivity in at least 2 areas, recurrent suicidal behavior, gestures, threats, or self-mutilation, affective instability due to a marked reactivity of mood, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, and or transient stress-related paranoia or severe dissociative symptoms. You'll hear the presenters talk about these symptoms today in different treatments, and so you can refer back to these symptoms when they're talking about it. Another way to think about it is that there are really 3 core areas of dysfunction associated with the diagnosis: unstable relationships, affective dysregulation, and impulsivity or self-control. BPD is fairly common. Community studies have found that it's in 1 to 2% of the population, and some studies have shown up to 6%. And in terms of clinical services, they can be 10% of outpatients and 20% of inpatients. I don't want to take up too much more time. I just want to say one thing. When I first started studying psychology as an undergrad, I was introduced to the concept of BPD, and it was introduced to me as a disorder from which people never recovered, they never changed, and there was no treatment. And we have come a really long way from that, and I'm so happy to have all our speakers here today that are going to speak to the effective interventions that we now have for the disorder and the changes that we see for people with the disorder. So I thank them all for being here today, and with that, I'm going to invite Dr. Witterholt to join me.